Title: Understanding Dental Caries, Causes, Prevention, and Treatment. Introduction. Dental caries, commonly known as cavities or tooth decay, is a prevalent oral health issue affecting people of all ages. Add circle. This article explores the causes, preventive measures, and treatment options for dental caries. Causes. 1. Bacterial action. The primary cause of dental caries is the action of bacteria, especially Streptococcus mutans, which produces acids that erode tooth enamel. 2. Poor oral hygiene. Inadequate brushing and flossing allow plaque, a sticky film of bacteria, to accumulate on teeth, contributing to decay. 3. Dietary factors. High sugar and carbohydrate intake can fuel bacterial growth and increase the risk of cavities. Prevention. 1. Regular oral care. Brushing teeth twice a day, flossing and using mouthwash help remove plaque and prevent bacterial buildup. 2. Balanced diet. Limiting sugary and acidic foods can reduce the risk of tooth decay. Calcium-rich foods strengthen enamel. 3. Fluoride. Using fluoride toothpaste and drinking fluoridated water can enhance tooth enamel resistance. Treatment. 1. Add circle, dental fillings. Commonly, dentists use materials like amalgam or composite resin to fill cavities and restore the tooth structure. 2. Dental crowns. In cases of extensive decay, a dental crown may be placed to protect and strengthen the affected tooth. 3. Root canal therapy. When decay reaches the tooth's pulp, a root canal procedure may be necessary to remove infected tissue and save the tooth. Complications. Untreated dental caries can lead to complications such as tooth abscess, pain, and even tooth loss. It may also affect overall health, as oral health is linked to systemic well-being. Conclusion. Preventing dental caries involves maintaining good oral hygiene, adopting a healthy diet, and seeking regular dental checkups. Early detection and treatment are crucial for preserving oral health and preventing the progression of tooth decay. By understanding the causes and implementing preventive measures, individuals can promote a cavity-free and healthy smile.